Good morning, Elissa.
Good morning, Julie. Good to see you here.
You too.
Excited to talk today about our favorite subject of 2020, which is coronavirus infections and immune support. And today we're going to talk a little bit about how it's affecting our mental health and our brain health specifically.
Absolutely. It's a really important topic for everyone right now.
Definitely. I am Dr. Elissa Mendenhall. I've been practicing integrative brain and mental health medicine for 15 years now. And I practice functional medicine at the Amen Clinic in Walnut, California. I'm also the founder and director of the Amanda Clinic in Portland, Oregon, which is an integrative mental health clinic that's been there since 2012. I've also been a professor of integrative psychopharmacology at the National University of Natural Medicine. And I have had the honor to supervise several physician residencies for integrative mental health. And back in school, I first collaborated with Dr. Julie Brush here in 2003, not doing brain health research, but doing immunology research about the blends of botanicals and its effects on the different parts of the immune system. This research was published in 2006 in the Journal of Phytotherapy Research, and I'm very excited to circle back to that subject today with Dr. Brush.
Thank you, Elissa. I'm Dr. Julie Brush, and I went to school with Dr. Mendenhall at the National College of Naturopathic Medicine, which is now the National University of Natural Medicine in Portland, Oregon. And since then, I have been practicing, I've had family practices in both Oregon and Hawaii, and started with more of an approach, naturopathic functional medicine approach to primary care with an eventual emphasis on mental health. And most recently, I served as the medical director of the exclusive Hawaii on the Big Island, which is a holistic non-12-step addiction and eating disorder residential treatment center. And now I'm at the Amen Clinic in Los Angeles, which is Encino, California, where I practice brain health care and functional medicine. And I think it's really cool, Alyssa. We've known each other for 20 years, and we have been consulting on cases with one another for most of the last 15 years on a regular basis. So it's kind of fun to be able to come together and share this with others. And do some of our brainstorming together. And also, we're from Nebraska.
Yes, and happy 20th anniversary today. This is our 20th anniversary month of meeting.
It is, right? The first month that we met was in August of the year 2000. Gotta love it. Mm-hmm. And we didn't know each other in Nebraska. We both grew up in Nebraska. Mm-hmm. We did not meet in Nebraska. We did not meet till we went to medical school in Oregon together.
Mm-hmm. Yeah. And today we get to bring together two of our favorite subjects, which is immune function and brain function and brain health.
There you go. All right, so we're going to talk a little bit about COVID-19 and how it has affected neurological and mental health. Mm-hmm. And I think we could start with sort of the obvious, that we've all felt some effects of COVID-19 because it's changed the way that we live, work, and interact with one another.
Not much has changed life this much in the 21st century. It's been a journey.
Absolutely. And I'm seeing with my patients, I'm hearing a lot more anxiety and depression, struggle with some addiction, and unhealthy coping strategies. I feel like in the last couple of months that I've seen more of that. I think people have sort of, at the beginning, kind of thought, oh, this will just be for a little while. And now it's sort of really extended and it's become more of a marathon as opposed to a sprint. And people are finding that really challenging.
Yeah, we're talking a lot about the second wave of COVID infection, which is actually not the infection, but the mental health effects of all of the life changes, all of the losses, all of the grief, all of the anxiety and the fear And actually, one of the things we're going to talk about today is the neurological effects of coronavirus infection itself. So it's not the psychological impact of all the change,
Yeah.
direct impact of infection on our brains and our nervous systems.
Yeah, absolutely.
Yeah. Mm-hmm.
Learning some surprising things about that piece of it, for sure.
Mm-hmm. Yeah.
So should we start with sort of just talking about how people are experiencing their lives right now and what kind of effect that's having on mental health?
Yeah. It's definitely been such a game changer. People don't leave the house as much, and when they do, they're afraid. I remember personally my first few months of anytime I'd set foot in a grocery store, I'd get anxious and my thoughts would race, and I'd think about all of the things I had to do and the things I couldn't touch. And the whole thought process, do I have my mask on? Did I use my hand sanitizer? Is that person too close to me? Am I going to bump them? It's so many things just to do a very mundane thing like go to the grocery store, something I normally really enjoy doing.
Yeah. And I found that I've kind of gotten those things into my good routine. Like I remember to wear my mask. I remember not to touch things unnecessarily. I've got my hand sanitizer in my bag, in my purse, in the car. I still have a hard time with maintaining distance. When I'm standing in a line, my impulse is just to sort of relax and move closer to the person in front of me. And my husband's constantly going, come on back. I'm like, oh, right. I do better when they have like those dots on the floor
dots. Very helpful.
As a reminder of where I'm supposed to be. So, but I want to say that I don't love the term social distancing because I feel like what we really need to be aware of is physical distancing, right? We need to make sure we're at least 6 feet away from people and who we're not living with. And the reason why I don't really like the term social distancing is simply because I think socially, some people are really feeling isolated, right? And I feel like it's important to maintain our social connections with people so that we don't feel isolated or alone, so that we are able to maintain friendships with neighbors and friends and family. And I mean, luckily, we do have the internet. We have cell phones. Even though it's not the same, it is a connection, and it can be one way to keep feeling connected. I really encourage people to not hold back and to make phone calls and to make video calls and to make video dates with people. And I think it's really helpful, especially since this has really gone on a long time. Say hi to your neighbors. I felt like for a long time people were sort of hiding and being a little afraid. But the reality is, you can have a nice hollered conversation from one yard to another. A couple of weeks ago, I went to a coffee shop and they had outdoor seating only. And they happened to have tables that were 12 feet apart. They had like a whole group of tables that had a nice outdoor area. They were all 12 feet apart. And we ended up having this lovely conversation with 2 other tables of people. It was so refreshing to have, conversation with friendly strangers in a safe way. And I just think we need to remember to connect.
Yeah. I think we have definitely erred on the side of drawing back, which we had to do at first, but now we know we're kind of armed with knowledge that we know that we can, if we're outside and we're far enough apart and we're wearing masks most of the time, it's a pretty safe engagement. So I think something I talk to my patients about on a regular basis is the importance of remembering that we are part of a greater human family. And that's huge for our brain wellness. And that's why we talk about it so much at the clinic, is because in order for our brains and our minds to thrive, we have to stay connected with each other. We need to rely on each other. That, back in the day, if we isolated and were by ourselves, we'd get eaten by a saber-toothed tiger. So we need to rely on the protection of our pack of sorts, of our people, and we need to re-engage them in order to do and be our best.
Yeah, I think I love that, to remember that we're part of the human family. Yeah. And I think that, another area that's been really hard for people is self-care. right? So people talking about, not getting enough exercise because their gym is closed or their favorite yoga class, not eating healthy because they've sort of fallen back on less healthy eating patterns as a unhealthy mental health coping strategy, right? And I think that unfortunately those things are actually putting us at higher risk. Like we talked about in our first talk about immunity in COVID-19, it's important that we exercise and that we eat healthy, because those are actually keeping us healthy. If we do, happen to get COVID-19, we're less likely to end up in the hospital if we have, good amounts of antioxidants in our system and vitamin D because we went outside and got some sun on our skin, et cetera.
Yeah, and I think one of the biggest challenges now, people were great at stress COVID cooking, sometimes not the health choices, but some people were really upping their games in terms of doing cleanses and they had the time and space to really do that extra cooking. And so a lot of us still do. So we can take that and run with it. But I think one of the bigger challenges has been figuring out how to exercise the way that we enjoy. And it has to maybe be different than the way that we used to. Sometimes gyms are still closed in a lot of places. Sports are not available for a lot of people. And many people just don't feel comfortable doing the things that they used to do. They are available. So I'd love to talk more about the creative things people are doing to keep their bodies moving and keep healthy.
Yeah, absolutely. And I think that, it is really good. I really emphasize to get outside because of the vitamin D, because of the fresh air, and because in most cases, if you're out walking or biking, you can physically distance. So in some places, I think that you still have to wear a mask outdoors, but in a lot of places, as long as you can maintain physical distance, you don't have to wear a mask outdoors. And I think that's ideal. You're getting a little bit of sun, you're getting some fresh air and exercise. We know that exercise helps everything. Sends blood to the brain and to all of the limbs, helps to flush out toxins, it helps to improve our neurotransmitters like serotonin and dopamine that make us feel happy and well. And I think that that's really important.
Absolutely. And I think also people are figuring out ways to kind of do their routines at home. So lots of folks are doing Zoom classes or one-to-one trainings with some of their teachers, trainers, or physical therapists, if that's kind of what they need to do. And some of our staff have really raved about their new smart bikes that they got at the
It's true. And we found some video. My husband and I have been doing workouts in the mornings in our backyard. And it's a video. There's a lot of free videos on YouTube, but we found a system that gives you, I think it's 7 days a week morning workouts. And then they also have recipes. They have these fantastic, healthy recipes with pictures. I love seeing the picture of the food because I'm like, I want that. And then, we're trying new recipes that way as well, which was really, it was something we paid for, but it was actually really reasonably priced considering we have a year's worth of access to these workout videos and healthy recipes, So there's a lot of sort of cool things that people are doing. My favorite yoga studio is now broadcasting all of their videos online. So there are things like that where figure out what you would enjoy and then get moving, figure out how you can make it happen.
And the weather is such that there's so much we can do outside now. I've seen people having classes outside, and I'm fortunate to live in a place that we can do lots of hiking opportunities. That's pretty safe. Even if the trails get a little crowded, we can navigate as long as we're not spending a lot of time in proximity with another person. It's fairly safe and we're wearing our masks. Yeah. We even invented a new sport in our house.
What is it?
This is how we do our very, very modified version of high intensity interval training, which is short bursts of intense exercise with lower intensity movement in between. And we take our dog to the park and we throw the ball with the ball flinger.
Yeah.
Everyone races to get it.
Along with the dog. Everybody runs.
The dog. We call it dog ball. And sometimes we'll even bring tennis rackets.
I love it. I love that.
We'll try to compete with the dog to get the dog ball.
And I bet the dog loves this game as well.
Uh-huh.
Yeah.
It's fun for the whole family, for sure.
I like that creative solution.
Mm-hmm.
So, what else can we tell people about good coping strategies? Let's see. You know, I could share my 5 senses exercise. Do you want to go through the 5 senses exercise with me?
I would love that. And this, I love that doing anything like that. I'm just thinking about when I used to go to the grocery store at the beginning of the pandemic, I would get this rush of energy,
right?
Hyper-focused tunnel vision thing happening, and concerns would flood my mind about infection. And that would have been a great place to do a grounding exercise like the 5 times.
Yeah. I mean, it sounds like you had a wave of anxiety, right?
Mm-hmm. Yeah, I was worried about
it's really uncomfortable. You know, usually then it comes with like the heart is going faster and breathing is faster. It feels hard to calm down. The 5 senses exercise you can do anywhere because you're just doing it quietly to yourself. Even if you were in the grocery store and this happened, you can literally just step out of like the flow of foot traffic and take a few minutes to breathe and walk through the exercise. So let's just do it real quick, and I'll just talk through it. And then any of our viewers, I would invite you to do it as well. You just want to sit with both feet on the ground. You can stand with both feet on the ground and your hands in a relaxed position. So like mine are just in my lap. And then if you're able to close your eyes, I like to have your eyes closed at the beginning. And just take a couple of breaths. And if you're feeling pretty anxious, your breathing might be kind of fast. If you can slow it down a little, that's great. And just take a few slow, relaxing breaths. If your breath is fast, that's okay. Just go with it. See if you can gently slow your breath. If I'm feeling really anxious, I might count the breaths just because that makes it a little easier for me to slow them down. One way that you can count is to do a slow in count as you breathe in. So if you're breathing in, you go 1, 2, 3, 4, and then hold 2, 3, 4, and then release 2, 3, 4. Hold 2, 3, 4, and breathe in 2, 3, 4. It's okay if that feels too slow. You can work up to that. And then it's okay if you're still feeling a little anxious, but we're going to start with the sense of sound. So I want you to focus on your sense of sound and identify 5 sounds in your surroundings. Once you've identified 5 sounds, take a breath and release. And now I want you to focus on 4 touch sensations. For example, this could be a little breeze or air on your face. It could be the clothes on your back and your feet on the floor. 4 things that you can feel with a sense of touch. Take a nice breath in and out. All right, and then I want you to just gently open your eyes. Keep your gaze down, but open your eyes. And I want you to identify 3 things that you see. And then have a nice breath in and back out. We're going to focus on the sense of smell. See if you can identify 2 things that you can smell. And have a nice breath in and back out. And then you can raise your eyes, look around. And then I invite you to taste one thing, that final sense. So a lot of times I'm always carrying water. At that point, I usually have a drink of water. And that is the 5 senses. Awesome. And what that really does is it puts us back in our body, right? It reconnects us to the major senses. And it's a really powerful and calming exercise. You can do anywhere. You can do it quietly. It just looks like you're standing quietly and breathing. And I've actually seen this really pull people out of a panic attack, just to ground in the physical body with all the senses. You can do it anywhere, everywhere. You can do it once a night, once a day, if you find it helpful. And another thing that I really want to mention is this kind of grounding and focus on the breath and the senses is sort of a form of meditation as well, right? It's a brief one, but I really do like meditation as well. And I find, especially if people are feeling anxious or if they're not feeling like they can relax and go to sleep, I really encourage people to try some meditation. There's some fantastic apps on the phone. They're free. You can put an app on your phone. And a lot of times people find that if they have a calming voice to guide them, it's a lot easier than just trying to sit and breathe and clear your mind, right? That can be a big order. I mean, people who've meditated for years still have to work at that. So it can be nice to have a coach if you're first trying meditation, or if you've tried it before and you're like, yeah, it's not for me. Like anything, it can take some practice, and any amount's helpful.
I love seeing how you teach the 5 senses exercise a little bit differently than me, and how we can all do it a little bit differently and it'll still work.
Absolutely.
I will often coach my patients to either do it in a visit with me or outside of a visit. And often I'll even do it much faster than you described. At a quick, describe something that you see, describe something you hear, that you feel, that you taste, that you can smell. And even that in the course of 20 seconds can completely change how a person is. I can see it change in them.
It changes the focus, right?
Changes their focus and their entire demeanor and expression. Yeah.
Love it.
Very powerful.
Yeah.
And I know that there's been a fair amount of research done on that kind of structured breathing that you were guiding.
Yeah.
And that changes our nervous system from having a sympathetic response to a parasympathetic response. And it physically changes what our brain is doing, and it physically changes what stress hormones we're secreting and what our heart rate does. So it's very powerful, even though it's very simple.
I know. I love powerful yet simple therapies that are really accessible to people.
Mm-hmm.
Yeah.
Yeah. And it doesn't take long. I mean, people have an idea about meditation being something that you spend half an hour a day doing, and certainly that has amazing benefits. But my practice has always been something more like 3 to 5 minutes a morning. And I feel very different if I miss it versus if I do it in the morning.
Nice. Yeah. I always tell people to start with 5 minutes. Mm-hmm. Even 5 minutes, like you said, can be very grounding and centering. And you're doing it in the morning, so it's probably just a fantastic way to start your day.
Exactly. Mm-hmm.
Nice.
Yeah, kind of like brushing my teeth. It's like brushing my brain.
I like that. So, do we want to talk a little bit about concerns about COVID brain and what that is?
Yeah, so there's this whole other side of impact of COVID that is beyond just kind of the stressors that we're all experiencing going through this process together. It's really, what is this virus and the infection that it causes? What is that doing to our nervous system?
Yeah.
Making profound changes, and we're just starting to learn about what that looks like.
Yeah. And I think when I first started hearing about potential nervous system changes for people who had COVID-19, I took it differently than what we're sort of learning about now. I thought, well, of course, if you're very ill in a hospital and isolated and in a situation where you could live or die, of course you're going to come out of that with some trauma responses, some anxiety or depression. That makes a lot of sense. But what we're finding now is that it's not as simple as all of that. And then we're actually seeing that the COVID-19 virus may have direct physiologic effects on the nervous system and the brain. I want to share, there's a study that was published online July 2nd in the Laryngoscope. And the finding is that depressed mood and anxiety were most strongly tied to olfactory dysfunction. So that means when people have symptoms of reduced taste and smell, which can be symptoms of COVID-19, then it increases the chances very significantly that they will experience depression or anxiety after the illness. So what that suggests is that people who we might consider to have like a more mild version of COVID-19, less focused on the lungs, right? So maybe they didn't end up on a ventilator in the hospital, thank goodness. However, because that virus actually affected the nervous system, we may see some more nervous system related outcomes that are concerning.
Yeah, it's like there are two different kinds of COVID infection, really. There are probably multiple kinds. And I understand how COVID is having these sort of more longer term sequelae or consequences. We get to understand the different types, but those are two types. We know the respiratory type. We know there's also this sort of clotting type. And then maybe there's also, there apparently is a nervous system type that is affecting nerves directly. And we've actually, a research study came out a couple months ago in the journal Altex that showed that COVID was rapidly replicating as a virus inside of human brain cells.
Oh, wow.
I mean, that can even happen.
Yeah, which is concerning for sure. I think that it's really important. Like when I hear that, I feel very concerned. And I think that one of the takeaways from this is that if you or a loved one did get COVID-19 and you're experiencing some longer term depression, anxiety, or maybe other nervous system effects, to pay attention to that. And to make sure that you do get professional support. That could look like seeing a counselor, seeing a psychiatrist or a neurologist, seeing someone like, someone who has an expertise in brain health, like we have at Amen Clinic, and just not to downplay this as, they're just, anxious because they had COVID and it was hard on them, but to recognize that this might be a part of the way the COVID is affecting their nervous system. And it can be very concerning and want to make sure we give it the attention it needs.
Yeah, some of the stories of people who are dealing with the longer term sequelae or consequences of infection, calling them the long haulers. I think that was a term coined in the UK. But they are having sometimes the first time they've ever experienced real depression or anxiety. So it can look familiar having this to them. They don't understand that these dark thoughts that are occurring to them, or this lack of desire to do anything, or lack of enjoyment from doing the things they normally do, is what we call depression. And in this case, it's very much so a medical issue because it's being caused by this virus or the infection that the virus is creating. So the invitation is for people who have had this experience, and we're calling it at the Amen Clinic COVID brain, kind of the umbrella term for all of the neurological consequences from the infection. People who are experiencing COVID brain need to get help for especially the neurological and mental health part, because that's treatable. There are so many long-term consequences from this infection that we're just starting to learn about. And we really don't want your mental health to be one of them. We want it to get treated as soon and completely as possible.
Yeah. And I think that this is it kind of circles back to the beginning of our talk and how important social connections are, right? Because, especially maybe somebody didn't have depression before and now post COVID-19, they do, might not recognize what's really going on. Friends and family who are connected with them might go, wait a minute, what's going on? You don't sound like yourself, right? So stay connected, and talk to people in all of the creative ways that you do, because it's important for so many aspects of our health.
Yeah, and also other things we can do to help our mental health that are simple, like going back to the beginning of our talk about vitamin D, that as we're going into winter, people with lower vitamin D levels, especially deficiency, tend to get more depressed, and they tend to have more issues with immune function, including getting the flu or colds, and apparently COVID infections. So make sure your levels are good going into the winter, and that will help keep your mental health sound as well.
Yeah, it's a great time. Usually I tell people right now, we're at the end of summer. This is when your vitamin D levels are likely to be as good as they're going to get if you're not taking a supplement, right? So as we go into the darker months, especially if you live somewhere where there's a lot of cloud cover during the winter, Pacific Northwest, for example, or where it's going to be too cold for you to go outside and get some vitamin D, this may be the good time to talk to your doctor, your functional medicine doctor, your naturopathic doctor about how much vitamin D you should be taking to really support both mood and immunity.
And even in sunny places, people in the winter, they get less intense light exposure. So they're more likely to get vitamin D deficiency, just even if they spend the same amount of time outside.
Right, absolutely. And if you have darker skin pigment, definitely get your levels checked, figure out how much you need, if at all possible. As you're really at higher risk of that vitamin D deficiency. Yeah. What do you think, Elissa? Do we have anything else that we should discuss today?
I think it's been a great talk. I really enjoyed it, and I hope that we have provided some useful information to people that they feel like they can take this information and run with it and help them deal with all the changes with the pandemic in 2020, help them have better health outcomes if they do get sick, prevent them from getting sick, and help them stay sane in what can feel like a kind of crazy time.
Absolutely. Thanks, Elissa. It's always good talking to you.
Thanks. Good to talk to you.